Integrative bodywork is a smarter approach to bodywork. It creates bodies that are better at self-correcting. This approach is rooted in osteopathy, so the work is generally performed while fully clothed without abrupt mobilizations or painful massage. Instead, it is focused on gentle work around the cranium, spine, and joints. Integrative refers to something that causes parts of a pattern to coordinate or integrate. For example, bodyworkers often focus on balancing the pelvis because of its integrative effect on the rest of the body. This common problem of a weak ankle that is painful on the outside is a great example. A trigger point in the peroneus longus generates the weakness and pain. A problem in the tibiofibular joint supports that trigger point. A pelvic shear supports that joint problem, and a cranial pattern supports that pelvic shear. Working around the ankle more directly addresses the concern. However, cranial work addresses the issue that supports the problem in the hip, the lower leg, and the ankle. Typically, sessions are focused on reducing pain while increasing strength and flexibility. These sessions begin with testing movements and ranges of motion to identify the issues. Then, the practitioner focuses on techniques related to the problems that were identified. Typically, these are gentle, sustained releases. There's a focus on integrative techniques, but at times, symptomatic work is needed for relief. After the work is completed, additional testing verifies that the work was effective. At times, exercises and other forms of self-care may be employed to support the bodywork. This process creates bodies that are stronger, more stable, and better at self-correcting. This results in improvements that continue for months after the treatment. If you'd like more information or you'd like to set up a session, you can call, or even better, text at 404-226-1363. You can also email to integrativeworks@gmail.com.